Alzheimer's disease normally starts 30 years. The pathology behind it, the disease behind it, the inflammation behind it often starts 30 years or more in advance before we actually see symptoms. Because what we're finding is that
Dr. Josh, welcome to the Beljanski Cancer Talk Show. I'm delighted to have you tonight. I had the privilege to hear you speak at Hippocrates. You are the Chief Medical Officer of Hippocrates, which is more well known for cancer than for Alzheimer, but your talk was about Alzheimer. And I thought it was so interesting. We know that there are so many diseases that are coming from the same cause, but we do not often associate Alzheimer with cancer. How prevalent is Alzheimer in your practice? Because at Hippocrates, I assume you see a lot of cancer patients.
Yeah, Sylvie, first of all, thank you so much for having me on your podcast. I really appreciate this opportunity. Yes, in terms of Alzheimer's, first of all, it's very common, 7 million cases in the United States and many millions more around the world. But specifically at Hippocrates, you're exactly right. Hippocrates historically started back in the 1950s, taking care, focused on cancer. But since then has definitely expanded to other chronic conditions, including Alzheimer's and other neurodegenerative conditions. And Alzheimer's has expanded the numbers. That's why I definitely am seeing more and more cases of Alzheimer's and dementia and other brain disorders.
I love that you have wellness approach of Alzheimer, which is common to other diseases actually, like cancer. In your view, what is a common route to all those diseases which happen in excruciating numbers? The numbers keep climbing, whether we speak about cancer or Alzheimer, every day we reach new peaks of numbers, unfortunately. Why do you think we are having this condition?
Yeah, so I think that's a great question. I think one reason is if you look at it, a lot of the commonality between these diseases is inflammation. That inflammation itself, having someone's immune system revved up more than it should be, can lead to cancer, it can lead to Alzheimer's, it can lead to heart disease, it can lead to rheumatoid arthritis, it can lead to so many different chronic conditions. And then the question is, why are we seeing more and more of these inflammatory type conditions? And one of the reasons is environment. We're seeing more and more toxins in the environment. And what in the world do I mean by toxins? From my background and obviously your background in biochemistry, it's amazing how many different toxins there are out there, whether we're talking about heavy metals, plastics, pesticides, and forever chemicals. What's scary is that we live in an industrial society that's pushing out more and more plastics, heavy metals, and forever chemicals every single year. Unfortunately, most of these chemicals do not decay quickly in the environment, so then they build up in the environment. And unfortunately, they build up into our food supply and then they build up inside of us. So that's the tragedy that, I mean, I like technology like anyone else, but unfortunately, there has not yet been enough focus, in my opinion, on how to utilize technology safely when it comes to the raw materials and the components that, just take plastics where, yeah, I mean, plastic is it's been around for
Yeah, it's
60
everywhere.
years. It's super convenient, but unfortunately, these plastics, they build up in the brain and they can lead to, I think they can lead to dementia And I think they can also lead to cancer. You've got this abnormal material that our bodies were not designed to deal with. And it's basically, we're doing this big experiment, and I don't like the way it's headed.
But for people, I mean, you cannot easily wake up one morning and say, okay, no more plastic in my life. I'm going to get rid of all the plastic. Then I'm going to get rid of all the chemicals. And then I'm going to get rid of all the processed food. Before the end of the day, you don't know what to eat, what to breathe, what to handle, because plastic is everywhere. So what is your recommendation as a doctor to have a path to less toxicity without being overwhelmed?
So the first thing is, I don't want to get people stressed out there, because I see that stress and anxiety, that can actually trigger different diseases, whether it's cancer, Alzheimer's, heart disease, etc. So the first thing is, I'm saying this in a perspective of, please don't get overwhelmed. Take this information and try to improve every day, every week, every month, and every year. For example, you've got a choice. You can choose to drink water out of glass or a non-toxic material, or you could choose a plastic cup. And what I'm saying is, when you have a choice to use or to purchase, choose glass or choose stainless steel or ceramic, something that's non-toxic. But you're exactly right. It's not possible to completely remove plastic from your life, but try the best you can.
Do you have general strategies that you can offer, a course, or how do people get educated about everything they need to get rid of in their life or to include, learn to include in their life?
Certainly. So I do have a lecture specifically on toxins and recommendations there, and people can find it at drjosh.com. But what I would say is, don't just look to me. There are other amazing organizations that you can turn to for help. One of my favorite is the Environmental Working Group, ewg.org, and they have some amazing suggestions before you go out and purchase, whether it's cooking ware, clothes, even cosmetics or shampoos, that you can actually look in the ingredients and compare it to their database of, is something safe or not. Because I understand most people don't have our biochemical understanding. In general, if you look at an ingredient of a shampoo and you see a chemical there that you don't recognize, that should be a red flag, because normally we should be using things that we recognize. It is scary how something that sounds completely innocuous, like natural colorings or natural flavorings, that, at least in the United States, those terms can be used to hide highly toxic petroleum based chemicals that may be inexpensive to produce but are not optimal for our health, because many of them can get trapped. If they're fatty toxins, they can get trapped in our body. They may have a half-life of 10, 20, 30 years, and once they get into our fatty tissue, in our brain, in other fat cells around the body, it's really hard for the body to get rid of them. And then they often will cause inflammation. And again, that inflammation is one of the common root causes of so many chronic diseases, including cancer, diabetes, and Alzheimer's, etc.
I would like to go back to inflammation, but before that, specifically at Hippocrates, where you live now, basically, that's where you work, and they teach you a lot of things about lifestyle changes and nutrition. Can you tell us more, a little bit more about how this can be a place for empowerment?
Sure. So I view Hippocrates as an oasis where people can go and reset, renew, and specifically focus on lifestyle. And what I mean by lifestyle is looking at what you're eating, looking and making sure you can reduce your stress, that you're getting exercise, that you're getting enough deep sleep, that you're part of a community. And what I love about Hippocrates is it's a great way to recharge, because there are no TVs, there are no stressful situations. It is a place that people can come to. It is a resort. You could spend all day at the pool or in the sauna or in the spa if you want. You can go to lectures. You can go to the gym. You can exercise. So to me, it's a way to break a stressful pattern. And I understand people can only spend, say, 3 weeks there. Eventually, they do have to go back to their life and reintegrate. But the exciting thing is, while you're there at Hippocrates, you get specific tools that you can use to transform your life once you go back to your life.
And you reduce inflammation, this famous inflammation.
100%, because all those things, if you stop eating highly processed foods with added salt, oil, and sugar, your inflammation will come down. If you're getting deep sleep, your inflammation will come down. If you exercise, your inflammation will come down. If you are part of a sense of a community, the studies are showing that your inflammation will come down.
And in 3 weeks, it's a perfect opportunity to learn new habits and to turn actually your life around, knowing that it's not going to be the end, but the beginning of a new journey.
And you're not doing it just by yourself. You're with a community of other people literally from around the world who are trying to do the exact same thing. And the exciting thing is often there are relationships formed there that continue forever afterwards, so from people all around the world. And I see that's one of the best things. I've been back at Hippocrates now for almost a year. And just the relationships I've had with guests and other visiting lecturers have been, it's been amazing. I sure there are other resorts around the world, but I've never found any place quite like Hippocrates.
To go back to Alzheimer, is there specific tests that you offer or a specific follow-ups that you offer for people who stay for a few weeks at Hippocrates?
Sure. So at Hippocrates, yes, we look at the root causes behind Alzheimer's and, frankly, all these other chronic conditions. I mentioned many different types of toxins, or sometimes it's infections. And the exciting thing is, we have specific functional tests that will look at heavy metals, at plastics, at forever chemicals, at pesticides, and we can use that information to design a specific detoxification protocol to safely push these toxins outside of people.
Can you tell me more about those protocols?
Sure. One compound that we like to use is glutathione, which is basically 3 amino acids stuck together. It turns out that glutathione is the master detoxifier. And I actually did a whole podcast episode on that on my Alzheimer's Breakthrough podcast. It's episode number 11. So if you want to spend an hour learning more about glutathione, I recommend that. So that's one compound we use.
Yeah,
And
and
yeah,
glutathione is something every time we speak about the liver. And yes, comes up. Glutathione.
right.
It's always good for everybody.
And not just the liver. What I like about it is it specifically inactivates toxic compounds to make it safe for the body
Mhm.
to process elsewhere. So glutathione is one approach. Another thing that's, I would say, fairly unique to Hippocrates is the use of wheatgrass juice. So the chlorophyll and other fiber in wheatgrass juice can be extremely detoxifying, to the extent that we normally warn people, if you're brand new to wheatgrass juice, start with a very small amount, because the last thing we want someone to do is to start detoxifying very quickly. Another technology, and it's not a new technology that we use at Hippocrates for detoxification, is water hydrotherapy, colon hydrotherapy, colonics. And that is another good way to wash out the gastrointestinal system to try to flush some of these toxins out.
Yeah, sure. A lot of people who are listening to us are also concerned with cancer and the side effects of cancer treatments, which can increase the cognitive decline because of the toxicity of the treatment itself. What do you do about that at Hippocrates?
Ever wondered about a supplement just for you? Introducing Womabel, made for the unique health needs of women, the natural choice for everyday wellness. Our formula, carefully picked, deeply researched, for real results. Packed with the power of Pau Pereira, exclusive green teas, and Rauwolfia extract. Every capsule is a step towards better health. Hear from those who felt the difference. Visit our website, masonbeljanski.com. Womabel. Feel the natural difference because you matter. Unveil the power of nature through Maison Beljanski, sourced from nature, perfected by science. Get 15% off your first purchase with code EP2. Feel better naturally.
Sure, and you're exactly right that chemotherapy itself is a poison. You're basically trying to poison the cancer cells in your body without destroying your normal cells. And chemotherapy is they're real toxins, and you're exactly right. Often, one of the side effects I see of chemotherapy is what's called chemo brain, where some of these toxins will actually affect normal brain function. The good news is that we have technologies, ways to rejuvenate the brain when this happens, not just using glutathione. One of my favorites is using exosomes. Exosomes are like stem cells, but they're not alive. And because they're not alive, they cannot be injured by chemotherapy or other toxins in the body. So it's exciting to see someone's brain come back to life using some of these cutting edge technologies like exosomes, which are essentially a collection of over 500 different growth factors. And those growth factors, it's amazing because the body is smart. Those growth factors will go wherever in the body. If you give them intravenously, they'll go wherever in the body they are needed. And if you have chemo brain, if you have damage to the brain, those growth factors will specifically target and seek out the brain and start regenerating neurons and neural synaptic connections that are also important for normal thinking, normal cognition.
Yeah, I find it fascinating that you speak about this technology, which is able to recognize where it needs to go. That's also what we see with the plant extracts we are working with. Paupera, Ravolfia, vomitoria, they are able to recognize very intelligently where they are needed, where there are abnormal cells, and destroy selectively those cells. It's amazing how nature has given us the tools to heal our bodies. It just we need to know where to find them and recognize them. And by the way, the Paupera crosses also the blood-brain barrier, which is also a very valuable tool.
And I've got to say, I'm just so in awe of your late father, who was skeptical,
Thank you.
had a huge mind, and realized that life is so complicated and complex, and was willing to go against the very narrow party line and say, you know what, there are other things here, including a way to fix cancer if we can specifically target cancer cells without hurting normal cells.
Yeah, and he also spoke about the toxicity of the environment as the thing triggering cancer mutations, and everybody was laughing at him at the time. And now it's a common talking point. Nobody is laughing about pollution anymore.
True.
More people, almost everybody after 65, everybody who has received their Medicare card starts to be concerned about brain fog and losing a little bit of memory. And everybody is wondering what is normal and what is not normal, and when should I start to worry, when is forgetting where I put my keys starts to look like Alzheimer, and what should I do preventively?
Yeah, so those are really great points because, of course, everyone at any age is going to occasionally forget misplaced keys, etc. What we're looking for are changes. So if you're starting to lose your keys many times a day and that's not normal for you, if you're starting to get lost and that's not normal for you, those are all concerns. And I'm so glad you brought this up, because what we're finding is that Alzheimer's disease normally starts 30 years. The pathology behind it, the disease behind it, the inflammation behind it often starts 30 years or more in advance before we actually see symptoms. So it's a lot easier to fix and to address if you catch it early. So again, we're looking for changes in behavior, confusion, and not just, often people recognize this in other people. So if this is happening to someone, they actually may be in denial, and a friend or a family member can actually point this out. And I'm not saying everyone who gets a little bit confused has Alzheimer's or dementia, but it's worth looking into, again, because it's a lot easier to fix. Alzheimer's is an extremely complicated process because we're looking at between 30 and 200 root causes, whether it's too much blood sugar or insulin resistance, to head trauma, to some of the genetics, to toxins and infections. So it's highly complex. The good news, though, there is hope for reversing Alzheimer's. I've been doing it in my clinics for 7 years now, and it's such an amazing feeling to take someone who is confused, scared, and basically give them their brain and their life back. It's really moving. And unfortunately, so far, most doctors and the general public don't understand that there actually are modalities, there are treatments that you can do to reverse and prevent Alzheimer's. But I would say one of the most important things to do first is lifestyle, which is why I think Hippocrates falls right into that, because we're optimizing what people are eating, we're making sure they're exercising, we're decreasing their stress, and we're making sure they get the deep N3 sleep, because it turns out that deep sleep, or the lack of it, is the number one risk factor for developing Alzheimer's.
Is there a specific test that people can take? Because if it's a disease that evolves very slowly, it takes 30 years before you really start to see the symptoms. When you start wondering what is happening to you and maybe you should get tested, you are already far advanced. Actually, you have had that for 2 or 3 decades.
Exactly. So, for example, if the disease process starts 30 years in advance and you only become symptomatic a little bit in after 15 years. So specifically, one test that I recommend people look at is a test of brain function, a functional test. Specifically, my favorite one is called CNS Vital Signs, where it's a computer test where basically for an hour we'll give you specific tasks. You'll have to remember specific words and shapes and look at processing speed. And the exciting thing is, when you get this test done, you actually compare yourself to what a normal person your age should do. And then if you repeat that every year, you can actually see, is my reaction time getting worse? Is my memory getting worse? Or is it getting better? So I love the fact that we have objective technological ways to track and make sure that we're headed in the right direction.
Speaking of treatments, is there anything specific that you can offer out of the generic thing or the dietary supplements which are advertised on TV?
100%. Yeah, I'm one of the investigators of a FDA approved drug for compassionate use, an expanded access program that decreases inflammation in the brain of dementia and Alzheimer's patients. It goes after an inflammatory protein called galectin 3. Your listeners may have heard of lectins being in food and causing inflammation, but it turns out that humans, that we actually make our own lectins. In this case, I'm talking about galectin 3. it's normal to have a small amount of this protein, but unfortunately, in chronic conditions, including Alzheimer's, many cancers, and rheumatoid arthritis, many inflammatory conditions, increased amounts of this galectin 3. And the exciting thing is, this medication is an antibody against this galectin 3, lowers the galectin 3, and I'm seeing reversal or improvement after just one intravenous dose of this medication. We normally do it once a month for 6 months, but it is so edifying to see improvement for a disease process that 30 plus years ago, when I was in medical school, I was taught there's nothing you can do about Alzheimer's. And by the way, you can only diagnose it at autopsy when you get brain tissue and look at a
Mm.
microscope there. And the whole field has made leaps and bounds, advancements. It's just the general public and many physicians don't understand that yet. And that's my vision. That's my goal, is to spread the word that there definitely is hope for preventing and reversing Alzheimer's.
And what do you think of chelation and oral chelation as a part of lifestyle?
Yeah, so I think chelation therapy is important for people who have heavy metals. Unfortunately, many of us do have heavy metals, whether we're getting it from our food or from the water. And chelation, to my mind, chelation is where you actually bind up, you chelate the heavy metal. And the easiest way, the simplest way to do that is with an oral binder like modified citrus pectin, or Pectosol is the compound that's been studied for over 20 years. So that's
Mhm.
oral. But if someone has high levels, very high levels of heavy metals and is symptomatic, then we'll use intravenous chelation therapy. But normally for lower exposures, I'll try oral chelation first.
Okay.
As you mentioned with your father, recognized that the environment is so important for the development of disease, including cancer. And we see that with Alzheimer's, we see that with other neurodegenerative diseases. What strikes me is that it is such an important force, but many people are just unfortunately, they're either ignoring it or they're not being told. There was a recent study showing that if you live close to a golf course, you're at much higher risk of getting Alzheimer's. And behind the scenes, what we know happens is golf courses, they look beautiful, they're nice and green, and they're green because they get extremely high amounts of pesticides sprayed like atrazine. And we know that atrazine is an endocrine disruptor, a brain disruptor. And that's why people who live close to a golf course get exposed to high levels of toxins like atrazine through both the water and the air. I think there should be fair warnings before you go onto a golf course or before you buy or rent property near a golf course.
Yeah,
So,
and they also get increased risk of prostate cancer and pancreatic cancer also because of all those pesticides that they inhale. And those pesticides, when inhaled, they have to go somewhere in the body. So it attacks some. Sometimes it attacks the brain. Sometimes it attacks some other organs. Absolutely, yeah, yeah.
and I think if there's enough pressure, people could still play golf. They're not going to play it on a beautiful green lawn that has all these chemicals. There are other ways to play golf without using all these chemicals.
Yes, that's part of lifestyle, how to get it and how
Right,
to avoid
right,
it, the
right,
choices
right.
that you have.
And I will mention another hopeful area, specifically around Alzheimer's and toxins, is we're now using an ancient technology called total plasma exchange to filter people's blood out of toxins who have Alzheimer's. This technology has been around for over 50 years for some immunological problems, but we're now using total plasma exchange, where we're taking blood out of one arm and getting rid of the toxins there. And then in the other arm, we're putting in albumin protein as a replacement to keep people's blood pressure up. And what we're seeing is after 6 of these purification total plasma exchange, we call it TPE, after 6 of these, we're seeing improvement in people's Alzheimer's. And again, it's published, it's in the literature, but most physicians, most people are not aware. So what I would say is now there is actually is a reason to aggressively prevent and treat and reverse Alzheimer's, because we literally have so many tools now, and the information and the number of technologies available for us is improving, it seems, every single month. So I'm just so optimistic. And you're exactly right. My focus isn't cancer, but it's exciting to see these tools. And let me give you one more tool that
Sure.
is an ancient tool that not only helps with Alzheimer's and metabolism, also helps with cancer, and that is fasting. I worked at a fasting center called True North in Northern California for 3 years, and I saw with my own eyes, I saw cancer being reversed and shrinking using fasting, especially for slow growing cancers. Now, fast growing cancers, patients would still maybe get chemotherapy, but if they fasted during the period when they were receiving chemotherapy, not only would the chemotherapy work better, so they would need fewer sessions of it, but they would get fewer side effects. So fasting, I find extremely helpful, not just in cancer patients, but also for people with neurodegenerative conditions like Alzheimer's, because when you fast, you decrease inflammation. And how in the world does fasting decrease inflammation? Well, one way is when you're fasting, you're not feeding the inflammatory bacteria in your gut because there's no fuel. You're literally, if all you're doing is putting water in your mouth for between 10 and 40 days, the bacteria in your gut are not getting that and not causing inflammation. So I would recommend everyone, if you're dealing with a chronic condition, or even if you're not, look at fasting as a potential technology, and you know acknowledging that you do not have to do a 10 or 40-day water fast under medical supervision. The way to start fasting is intermittent fasting, where, you know what, just skip breakfast, have a feeding
Mhm.
window of 12 hours or 8 hours, or as limited as you're comfortable with your lifestyle. And often people feel better because it turns out that our ancestors often had to fast because, unlike modern days, there wasn't food available 24/7, 365. So metabolically, our bodies are designed, our cells are designed to occasionally have times of famine, times when there aren't huge amounts of calories. And that's the time where the body would do something called autophagy, which in the Greek means to eat yourself. Basically, it would recycle and get rid of the damaged proteins so that the new healthy proteins could be produced when people started eating again.
Yeah. And that Hippocrates teach you how to fast safely. And it's a beautiful place. It's a really beautiful resort in a lovely West Palm Beach, easy to access. I would really recommend it to everybody, whether you have Alzheimer, cancer, or whatever else. But who doesn't have something that need to be cleaned and improved?
Agreed.
Well, thank you so much, Doctor. This was really extremely interesting and complements so well everything we speak about on a regular basis about cancer, and I'm sure will be of great interest to our audience. Thank you.
Thank you, Sylvie. Peace and plants.
Thank you. You too.